Hi everyone, I'm Heather Smith. I'm here from KSB Hospital. I am the infection preventionist here. I'm here to talk to you today about preventing infections and taking care of loved ones. I spend a lot of my time focusing on inpatient world, but I want to talk to you today about how we can kind of take some of those methods and use them in the outpatient world because that's just as important. We want to keep loved ones out of the hospital right now. To keep them at home and safe from infection as flu season approaches. So let's go ahead and jump into what we're going to talk about tonight. So we have common myths. So we've all heard those common myths about how infection spreads. There's multiple different myths out there that I want to talk about with you tonight so that we're well educated and versed on how infection itself actually spreads. The do's and don'ts during the dreaded flu season. So flu season's quickly approaching. Schools are going back into session, into their new normal. So how can we prevent our loved ones we're caring for at home free from being exposed to the flu? Tips and tricks for properly cleaning and disinfecting. So we're gonna go over that those terms get misused quite frequently. It's important to know the difference between cleaning and then disinfecting, and then what that difference entails for us and means to us. And then ideas to keep in mind when caring for common medical equipment. So we have medical equipment that we maybe get discharged from the hospital with, or our loved ones get sent home with, and we always worry about how to use it, but maybe not necessarily thinking of how do I maintain it? How do I clean it and keep those things free from any kind of harm they may cause? So I want to kind of go over that as well for a way to prevent infection. And we don't have to make it difficult. It's actually quite easy to keep our homes very clean at a low cost as well. So let's talk about our first myth. And I know everyone's probably heard this one. Actually probably heard a lot of these. So if your loved one doesn't get prescribed antibiotics this flu season, or doesn't get prescribed antibiotics when they go in to see their provider, they will not get better as fast. All right, so there's a myth out there that antibiotics are needed if you want to speed up your recovery. But the truth is, antibiotics are only good if there's bacteria present. And a lot of things in the wintertime are viral driven, meaning there's no bacteria causing the virus, and therefore antibiotics are going to do nothing. And actually antibiotics, when prescribed incorrectly, can actually cause harm. They mess with our normal flora that our gut should have, and that can actually cause your loved ones more harm if they take antibiotics when it's not necessary, because antibiotics in and of themselves actually do not the antibiotics themselves actually do not know the difference between normal bacteria, the good bacteria that you want in your gut to fight normal things and to break things down, versus the bad bacteria that's making someone ill. So they'll wipe out everything completely. So the second myth that we talk about is if you go outside with a wet head, you're gonna get sick. Whose mom, told them that as they were growing up, like, don't go outside, you'll get sick with that wet head, or if you don't wear that winter coat, you're gonna get sick. You go out in the rain, you're gonna get sick. You have to, you're gonna get some kind of infection, we're told, right? So that's actually a myth, Mythbusters here, that if you go outside with a wet head, you're not going to get sick per se, right? So it doesn't mean that you're gonna go out and you're gonna develop an infection because you have a wet head. So that's not how infection spreads. Infection has to be spread by having some kind of viral or bacterial infection, and wet or cold in and of themselves do not cause that. Don't get the flu vaccine unless you want the flu or unless you want to get sick. This one right here is a very common believed myth, and it's very important that it needs to be a myth buster in and of itself, because this year, more than any, flu vaccines need to be given. So you don't want to get the flu vaccine unless you're going to get sick. But what can happen when you get the flu vaccine is you can become ill, maybe feel a little under the weather, feel a little down, maybe just don't feel like yourself. And that's your immune system, but there's no live virus in flu shots, all right? There's a live virus in our nasal spray that we get. So that, can sometimes cause some reactions maybe to something else going on. But with normal flu shots, you can get them if you're pregnant. We get that asked that a lot. If I'm pregnant, you know, is it safe to get the flu shot? Things such as that. With those flu shots, they're not going to make you sick. If you become ill after the flu shot, you were already probably had that virus in your system. And then our next myth is my loved one has MRSA, so I don't need to wash my hands as it won't kill it. So MRSA is methicillin-resistant Staph aureus. It is a common infection, and it can be community acquired or it can be hospital acquired. And it's an infection that has resistance to some of our frontline antibiotics that we use. So as antibiotics are used more and more inappropriately, we're finding that they're getting more and more resistant. So that's, again, why you want to really push for your loved ones to not have antibiotics unless they truly have a bacterial infection. With that, MRSA can be still killed on surfaces. So just because someone has MRSA and it's resistant to antibiotics, it sometimes gets misled that it can't be killed by using soap and water on your hands or using soap and water to clean or using any kind of cleaning agent on surfaces. That's not the case. It's only resistant against antibiotics. My loved one's fever is not too high, so they can't have an infection. This one's always kind of one of my favorites because way back when infections, you know, began a long time ago, you know, fever was always something people use as an indicator, and we still use it very much in infectious disease today. Fever is a sign of infection, but in a fever, how high and low a fever goes has many variables. So you never want to assess your loved one based on their temperature themselves. Clearly, if their temperature is extremely high, that needs medical attention. However, if that fever isn't very high, you can't say that the infection isn't bad because sometimes our bodies don't act in that way. All right, so you always want to make sure that if that fever is present, you always talk with their care provider. Don't ignore it, and don't assume things are fine. You definitely want to pay close attention to it. So those are a lot of the common myths we hear. So I hope that helped clear up some of the things that you hear out there taking care of your loved ones, that you can hopefully help you steer this winter as you hear different things out there, have that knowledge base to feel confident in making those decisions. So caring for your loved ones, I always like to talk, when I talk about this, I always like to remind people that it's a two-way street, all right? Infections work two ways. I tell our healthcare providers this every day, anytime I talk. We always worry so much about us as the providers that we worry about getting something from our patients, but in reality, they're just as much at risk of getting something from us as we are from them, okay? And it goes that way when caring for your loved ones at home too. So you are in close quarters when you live with a loved one. You're in close quarters with your family, your household contacts, anything of the sort. It's a two-way street. So we don't only want to spend tonight talking about how they can stay safe and free of infection. We also want to talk about ways that you can stay safe while caring for them. Some of those things we're going to talk about, different precautions you can take when you are caring for them with their medical equipment and different things that you're doing in the home to care for them. So prevention and treatment always need to be happening simultaneously, meaning we obviously will always use prevention as a first line defense, right? So we always want to do what we can to prevent infection. That's been very clear this last 6 months with COVID happening in the different communities and the different parts of the world, that prevention definitely plays a significant role in how things happen. But also when prevention maybe isn't at its best that it can be, or prevention doesn't happen soon enough, there's treatment, right? So we want to make sure that if a loved one's getting treated for infections, we want to make sure that we're still preventing other infections, because once someone has an infection, if you have a loved one, let's say, that's discharged with a urinary tract infection and they get home, they're more susceptible to obtain other infections. So we want to make sure that we're getting that infection dealt with. All right. And then also still maintaining very good preventative measures that we're going to talk about here shortly to make sure they don't obtain any other infection while their immune system is working on the current one. All right. So we want that to happen together. All right. So our do's and don'ts of flu season. So this is one of my favorite topics, actually, flu season, right? So we know sooner, I feel like, flu season gets over and we're preparing for the next one. Between the vaccinations and the promoting of the flu shots and just really educating. It's one of my favorite things to do. I want everyone to feel empowered to know what they really are getting, what the vaccine really does for them and their loved ones, and how they can make that feel-good choice that they are doing what they need to do to keep their loved ones safe. So my first and foremost advice I give people is to take the time. Sometimes it is really hard, I understand, to stop our busy lives to get vaccinated. And I'm pretty sure that we have done a really good job of making this easier for you with our drive-up clinic and different resources you can do at your provider's office to get your flu shot. With COVID this year, I know things have looked a little bit different for you, and different concerns have come to mind. So please keep in mind that it is still safe to see your provider to come in and get your flu shot. Most insurances will help you with that, and I think it's one of the things that is of utmost importance to do for a loved one. So this year in particular, what I want you to know that it's more important than ever to get that flu shot. So the flu shot itself, for those with underlying conditions, maybe immunosuppressed from chemotherapy or other reasons that you become immunosuppressed, it's very important for you to get that flu shot now. It will help you down the road. It will prevent some more time that you would be spending ill. And then also, one little point I put on here was the lack of routine care for some. So because this year has been a little out of our element, some of us have put off our routine care, which we're bringing back and really, wanting you to get back and get your routine care. But we also want you to know that also kind of hinders the fact that you haven't had that routine care, that you get the flu shot as well. Those that have underlying ailments are especially important to vaccinate. All right, so that's kind of the point I want to drive home there. The Centers for Disease Control and Prevention recommend a flu vaccine for anyone 6 months and older. So this year, other years, they are recommending still the 6 month and older age. That hasn't changed for recommendation. For adults that are 65 and older, they do not preference a high dose flu vaccine over a flu vaccine. So what that means is, some of you may have heard of a high dose flu vaccine, and those basically have more antigens in them to help those that maybe need a higher immune response to be able to respond to the flu vaccine itself. However, both of them work for those 65 and older, and at this current time, the CDC is not recommending one over the other, but either one is completely acceptable. There's no new timing of the flu vaccine this year recommended. However, the only thing you should know is your loved ones should have their flu vaccines after August. So they are saying that getting the flu vaccine in August is too early, as we don't want it to wean off, before flu season is over. So make sure when you do get them in to get it, that you are actually doing it after August. There's no delays in reporting currently as far as getting the flu vaccine. So the flu vaccine itself can actually come late some years. So we want to make sure that you know that right now, even with COVID in our world, we are still expected to get flu vaccines in. And then it does not protect against COVID-19. So unfortunately, there's some false information out there that the flu vaccine will help with COVID too, but that's not the case. But what is the case is that a co-infection prevention protection can take place. So the last thing we want is to have a patient that has to undergo COVID, having COVID-19 and having influenza this season. So we want to do everything we can to protect those against that. So everyday prevention is the best way to fight germs. This is something that we preach very much in the hospital. This is something we do on a routine basis, because even if we don't have anyone in the hospital, doing this daily keeps the facility clean and ready. COVID-19 has proven this point continuously during the pandemic of 2019. So COVID itself, we have implemented prevention into our daily lives. When we do our masking, we do our social distancing. Those are all things that we recommend for flu season and when taking care of an ill loved one. So social distance when possible, keep loved ones home if they're ill, especially if they're immunosuppressed. Keep them off our home as often as you can during flu season. And then the other thing is to remember that it's really recommended that anyone that has a fever stay home for 24 hours fever-free without any kind of fever-reducing medication. Even if that means coming, doing different things that you had that day, it's really important that you cancel them. Have that 24 hours fever-free before you, do anything else. And then frequently washing of your hands with soap and water or hand sanitizer. So either of these forms of hand sanitation are acceptable. It's all as effective as you perform it. So washing your hands with soap and water, that's 40 to 60 seconds is effective hand hygiene. Making sure that you're getting between the fingers, between your pointer finger and your thumb, making sure that you're getting, your wrists and everywhere else, and you're doing it for that allotted time. Just like I tell my kids, sing your ABCs 3 times, whatever you need to do to know that, it's not a quick rinse under the sink, and definitely not without soap. Hand sanitizer works as well. However, hand sanitizer is something that is nice to take with you. Make sure you have it with you on the go. It's a wonderful thing. So the hand sanitizer, the only time that I wouldn't recommend hand sanitizer, even in the home, is when your hands are visibly soiled. So if you have something visible on your hands, you really want to use soap and water for that. But hand sanitizer, as soon as you have covered the surface of your hands, it's worked, all right? So that's the great thing. Many studies have shown us in the AGIC journals and in different places in infection control that the hand sanitizer is more effective than soap and water. But a lot of those studies also point to the fact that hand sanitizer is done in an adequate manner, meaning we don't have any way to not do it long enough, such as when we wash our hands. So it's all in how you perform it and is how effective it is. The other thing you want to remember this flu season is to take prescribed antivirals. So antivirals are something that are given to someone that has become ill. All right. They can also be used as a prophylaxis for those that have been exposed to the flu. So they have a potential to make symptoms less severe. And by making symptoms less severe, they also decrease complications for these patients. All right. So especially with your elderly loved ones or immunosuppressed loved ones, you want to make sure that we're on top of those symptoms because they can turn fast. You want to shorten illness with these antivirals. And it's not antibiotics. So these antivirals are not the same as antibiotics, like we talked about earlier. These do not fight bacteria. This is an antiviral specifically for influenza, and it does not treat COVID-19. So if you are caring for a loved one who has had contact with an influenza case, has recently come down with influenza symptoms, or you yourself as their caregiver has been exposed to influenza, contact your healthcare provider. Because most healthcare providers will go ahead and prescribe prophylaxis of the antiviral. And then stay informed, all right? So when you're caring for a loved one, they rely on you for a lot of information, and you want to feel knowledgeable in that. So FluView is something that I use at the hospital. It's something I recommend for anyone that asks about how they can know what's going on currently with the flu season. It's on the CDC website, and it's a great way to be able to achieve this. So it's very nice, very user friendly, which I like. And I think it's something that can show by region. So also with the travel, anything like that, when you travel this flu season as well, between looking at what the COVID rates are and between looking at what the flu rates are, you'll be as up to date as anyone else. So, and then as far as KSB, we're here and ready this flu season, probably more so than we ever have. We've been ready for 6 months now. The flu season, more than ever, we have prepared for. So staying safe and ready for your loved ones. So if your loved ones do need to come into the facility, it is clean, it is ready. We have visitor restrictions in place to benefit those patients. So if your loved one does come down ill with the flu or any other ailment, we have visitor restrictions in place to protect them while they are with us, to protect them from being exposed to anything else while they're under the weather. So the don'ts of flu season. So the things you don't want to do in flu season, the things that make infections spread more, right? So large gathering, you do not want to touch your eyes, nose, and mouth. This is something that is really hard for some people are face touchers. They just, when they're stressed, they touch their face. When they're talking, they touch their face. Unfortunately, those people are at a high risk of having that be a portal of entry because you touch a surface and then you touch your face. And then your face is by your mouth, and then you're spreading it from surface to mouth that way. You don't want to skip the sanitizer. Sanitizer, again, is our friend. We want to keep that with us. It's easy to use, just a very great resource. And don't take shortcuts, all right? Make sure that you do everything properly, knowing it's a certain time to wash your hands, things like that. You don't want to take those shortcuts and risk getting ill. And then don't ignore symptoms, all right? As much as anyone, we don't want to have to handle an illness, which is why we want to prevent it. But if the prevention does fail, make sure you don't ignore those symptoms. Don't delay the care then, right? So that comes to our next point. So if you don't ignore the symptoms, don't delay getting care. So I wish I had a crystal ball and I could tell you all what 2021 flu season was going to be, but unfortunately I didn't have much to put on this slide except for what I've been educated on. And prevention is in place early for COVID-19, that we know. And all specialist providers alike know that we've had these prevention methods in place long before any other flu season that we've ever had. So it's going to be an interesting year when you do come upon flu season and kind of think about what it's going to look like. The experts are kind of having two sides, right? So we're putting prevention into place early. So that could kind of delay or maybe potentially actually even decrease what we expect. We've already decreased our public gatherings, and our vaccine is up to date this year already to match more consistent with the strains expected to circulate this flu season. The only downfall we are looking at that we have to consider this year is the fact of the routine care and the appointments that have been put off due to COVID. So between those two sides of it should make for an interesting year. However, the one steadfast we do know is to get vaccinated. So our environment and infection, I'm gonna I'm gonna go into now. So our environment, people tend to forget when you go home from the hospital or even just at home on a daily basis, how much our environment and what we're around impacts our infection risk. So infection has many routes of transmission. So it's not just because somebody sneezed. If it was one route of transmission, my job would be a lot easier. I'd appreciate it. But unfortunately, it happens through all different routes. We have the fecal oral route, and the hand to mouth, the sneezing, the coughing, the droplet, the contact. And all of them have different lifespans, right? So when you're considering the home where you're caring for your loved ones at, you know, look around, think about the amount of exposure that would be possible. You know, how many people are going in and out on a daily basis? How many times are you wiping things down? Things like that. We kind of focus so much on our loved ones and what's happening with them directly that we forget about the environment around us. So today I wanted to take the time, because this is something that I think everybody, all of us, get wrapped up in wanting that cleaner, right? Wanting that disinfectant. And it's used simultaneously, but really cleaning and disinfecting are two different things. But without cleaning, disinfecting doesn't work like it should. So the Centers for Disease Control and Prevention's definitions of cleaning and disinfecting are as followed. So you have cleaning, which removes the germs, dirt, but does not kill them, simply removes them. So when you're cleaning, I kind of think of it as dusting, right? So when you're removing actual particles, right? So you're wiping down doorknobs, you're removing fingerprints, you're getting the dust off in your environment or in your loved one's environment. But then disinfecting is when you come and use chemicals like EPA registered disinfectant to kill germs on surfaces. So just like in the hospital, when we clean equipment or when we clean instruments, we have to run them through a clean cycle. And then after we clean them, we disinfect, all right? Because if we don't get all the gunk and everything off first, the disinfectant can't work properly. So that cleaning optimizes the disinfecting of the environment. So it really makes that label come to life. You know, it really makes us have, when it says that it's, you know, 98.9% effective, that really means that you cleaned and then you use the disinfectant. All right, so please read all manufacturer labels on supplies, all the supplies that you're using to help clean for your loved one or use in the environment that they're going to be maybe when coming home. Make sure you know those labels. They sometimes have different recommendations about how long things need to remain wet or if they can be dried off before that time. And then even our electronics, I mean, how many of us carry cell phones or our loved ones use tablets, maybe, things like that. And many people think you can't clean them because they're electronics and they can't get wet, which is true. However, there's actually 70% alcohol that can clean those, because what the important part of remembering is it's ever so important to clean those high touch frequent objects, but you want to use something that's going to dry quickly. So alcohol, you want to go to that 70% alcohol to clean them or disinfect them. So tips and tricks, you know, probably not the tips and tricks that most people look forward to, but if you keep cleaning supplies nearby. So things I like to remember is when you're caring for a loved one, it doesn't have to seem so hard to keep everything so sterile, okay? So the trick here is that you want to make sure things are clean and disinfected and safe for the loved ones and for yourself, because like I said, we're also keeping you just as safe as your loved ones so that you can care for them. But you want it to be made seamless, so it doesn't seem like so much extra on you with already things that you may be dealing with. So I always say to when families go to get discharged and I speak with them, such as like a patient may have C. diff and they're being discharged home, for example, and the family wants education on how to kind of clean things and what do I do at home now? Well, I always say keep that cleaning supplies nearby. So every time that patient goes to the bathroom, they have that bleach spray or they can wipe down after themselves, things like that. Making it available in where it needs to be, you're more apt to do it. And then maintain a good supply. So like, just like we take time to, you know, make sure our pantry has supplies in it, we want to make sure we have that cleaning supplies ready. So having gloves on hand, having our preferred disinfectant on hand, having our bleach solution made up, having everything ready ahead of time makes a seamless process that we can make sure that we're following all the check boxes to keep our loved ones safe. Line the trash cans to make garbage removal easier. So especially if you're dealing with a loved one who has maybe a wound that's having dressing changes, or a C. diff that's going to the bathroom frequently, you want to make sure that, again, that you make it as easy as possible on yourself, but also so you make sure to do these things. So line that garbage can to make it easier for you to take it out. And then you can even make your own bleach solution. Again, there's many recipes out there for it. The main thing you want to remember is that it includes the correct parts of that cleaner. So 5 tablespoons of bleach per 1 gallon of water is just one example of a solution that can be used. So my little hint on here is, if you have a sporous infection, if you're told a loved one has, an infection with spores, a big one of this is C. diff, can only be killed with bleach. So C. diff is one that can live on surfaces for up to 6 months or so. So this is something that can kind of keep on giving, unfortunately, if not cleaned properly. So I always recommend making sure the family knows how to properly get their bleach solution made, and then where are those most frequent places to use it: the toilet seat, the countertops, all those different, the doorknobs, all those different touch areas. Or you have to have an actual designated sporicidal. If disinfecting wipes are not available, you can always do a DIY. You can actually make your own wipes. So COVID, if anything, has made us more resourceful than ever. We have learned that it is just as effective. You don't have to spend a lot of money at all to be able to do these things. Those supplies can be found at, Dollar Tree, Dollar General, all of it. So you don't even have to spend a lot of money to make sure that you're keeping your loved ones safe with cleaning and disinfecting. My other piece of advice, or my other trick, if you will, is make a schedule. It really helps when you have so much going on if you're caring for loved ones, especially the families that care for multiple loved ones. Make a cleaning schedule. This helps you know that, on Monday I know that I, looked after them and I cleaned their bathroom, deep cleaned their bathroom, however you want to do it, to make sure you're getting those things done. And then for sick loved ones, when we're caring for our sick loved ones, I like to go over non-porous versus porous. So this is when your loved ones come down ill with something. They're sick. So you're not just caring for them, but they themselves are ill. You have non-porous, such as high-touch surface areas, tables, light switches, remotes, and toilets. Those are the ones you want to wipe down frequently, multiple times a day, multiple times a week, obviously then, and then try to maintain separate rooms as much as possible. So when sending people home with any kind of illness, or if they come down ill when they get home, we always recommend to try to separate as much as possible that's safe for that loved one. So, because the more you have exposure, the more risk of infection. The longer you're with somebody, the more risk you have. So if bathroom sharing is a must, clean between each use. So if it was up to us, we'd say everybody get their own bathroom, but obviously not every house can have their own bathroom. We might not be able to have a house that has a bathroom for every household member. In that case, the person that's ill, the loved one you're caring for, if they are capable, we always say to recommend to have them wipe down each time that they use the bathroom. And again, having your cleaner in the bathroom at that time makes that a lot easier. If they're not, that's when you can glove up and wipe down safely after each use of them using the bathroom. However, using gloves is one topic at hand that I want to talk about. And gloves are really good when used appropriately. Gloves are not meant to replace hand hygiene. So sometimes we forget that if we have gloves on, we think that, we're safe from everything because our hands can't touch it. But really, people can do a lot of contamination with wearing gloves around if they're not changed between each cleaning, because those gloves serve just like our hands do, except for you can't wash them. So if you're touching the toilet, then touching your bucket of cleaner, and then touching the sink and touching the doorknob and walking out and touching the kitchen counter, you haven't done anything in that case. You've just contaminated everything. So those are things you want to keep in mind to change those gloves between each time you use them. Now your porous items are a little harder, right? So you have a loved one that has sheets that need, that you have sheets and bedding and carpet, things like that. You always want to launder items on the hottest cycle that it can handle. So anytime that you may be concerned with weeping wounds, from like maybe a MRSA infection that they have that you're caring for, or like, again, back to the C. diff, or different kind of things that they go home with that are infected. Sometimes we have colostomy bags that maybe leak. Always use the hottest cycle. And that is what's going to be able to kill that bacteria. It's going to be able to get up enough in temperature to help clean that. And then your medical equipment care. So your medical equipment commonly found in home include things such as Foley's, urinals, thermometers, and blood pressure cuffs. These are all things we use frequently. Anyone that has children probably owns a thermometer. We have Foley's that people go home with. You all want to maintain those at home, meaning, make sure you have the directions on how to clean the Foley's, how often they should be cleaned, making sure the urinals are washed out with appropriate solutions. The thermometers can be wiped down with alcohol. Blood pressure cuffs, the same. They can all be wipeable surfaces. So also when you're looking at purchasing home medical equipment, always look at how it needs to be cleaned, because sometimes that may sway you to purchase different medical equipment over the others if you're trying to see which one is going to be better. Ones that are not very easily washed and cleaned are the ones you want to stay away from. You want to be able to have it be convenient for you each time that you use it to be able to clean it properly. So before you handle any kind of medical equipment, you always wash your hands and read those manufacturer guidelines, because again, some manufacturers recommend different things. If a loved one is being discharged home with any new device, ask questions and take notes. Make sure that you ask those right questions before you go home. It's very overwhelming. They get a new device, maybe they're going home with that Foley catheter, or maybe they're going home with a colostomy bag, things like that. They're going home with those medical devices. You not only want to know what they're for and how to use them, but you also want to know exactly how to clean them. So you want to make sure you know how to care for the actual product itself. And then check and make sure you have supplies needed to perform that appropriate maintenance on those different devices, so that you have everything ready to go. You have everything readily available. If it's alcohol pads, different rinses that you need to do with it, different cleaners that you need to use on it or specifically, then you want to make sure you know that. And then know how frequently disinfecting needs to occur. All right. So know if they, how frequent you need to put that maybe on your cleaning schedule or anything of the sort. So a couple of resources I wanted to leave you with tonight that I always try to, when I get calls from people at home that are maybe having some questions once they've left us, I try to resort them always to Centers for Disease Control and Prevention. The CDC has a lot of home health stuff that is very helpful. The World Health Organization, and then local health departments. So those are the three sources that I recommend if you have any further questions after tonight's presentation to go ahead and look on.
All right, thanks everybody for being with us for another KSB Community Wellness Education presentation. Again, this was our caregivers support group. They used to meet in person, but obviously with the challenges that we currently face, Heather and the home healthcare team have been good enough to say, yes, we absolutely will get this word out, and we'll do it virtually, however we can get it to the folks that need our help. And Heather, you just did a wonderful job, and we so appreciate it. There will probably be some questions later, and we'll make sure we get those to Heather, and she's great at responding. She'll get that information back to us. So folks, keep on watching. KSB is here to meet all of your needs in any way that we possibly can. And these education presentations are one way that we can do that we can keep you informed, that we can keep you safe, because that's at the top of our list, taking care of our patients and keeping you safe. So stay tuned, the fourth Thursday of each month. So the fourth Thursday of September, you're going to hear again from the Caregiver Support Group virtually. And that will be for those folks out there who want to hear maybe about tubes and drains, if you have loved ones that you're caring for with those needs, as well as some other things. So stay tuned. This always starts at 5 o'clock. You'll also find this on our website, as well as it will continue to surface on our Facebook page. Also want to make sure that you're aware for KSB Community Wellness, we continue our brain health series. September 8th, we'll be sharing with you about suicide awareness. We have a great group chat that's going to happen that evening amongst 3 people from KSB, Val Roberts of our Behavioral Health Department, Wendy Soflo of our home health care, and then finally our third person is Laura Salsville, who's our manager in the ED. She's an RN for us, as well as she has many other titles too, and I apologize, I don't have them all in front of me, but just an excellent group. So you're going to want to tune in for that. And then for other events, go to our ksbhospital.com page and /events. And on our event calendar, you'll find everything that we have to offer in September. So again, thank you, Heather. An excellent job, as always, by one of our KSB professionals. Have a good evening, everyone. Thank you.